Do we see sciatica? This is a question we had from AJ asking after they saw one of our other videos talking about, I believe, migraines and headaches and dizziness, whether we also see sciatica. And it's a pretty logical question because a lot of chiropractors do see things like sciatica. Sciatica is leg pain, essentially. It's a very general term for saying that someone has any kind of pain or other symptoms into their legs. Usually it's going to be starting from something more local, say in the hips, or it can be coming from the lower back, what we call a lumbar radiculopathy, or sciatica coming from those lumbar nerves. And again, it's a good question because there are some cases we do see here in the practice. However, it's something that we do see much more rarely. Here we specialize in more neurological issues. This will be things like headaches, migraines, dizziness, vertigo, facial pain, neck-related issues, also some other things like, say, digestive issues. However, typically, if it is sciatica, what I would first advise for most people is that they will go and see a more traditional approach chiropractor first. Again, we're specializing in these neurological issues, so our technique's going to be focused really up here, and it can be very helpful for things like sciatica. However, for a lot of people, it can be something else that may be happening lower down the body, affecting those lumbar nerves, particularly if someone has maybe had an accident or an injury, maybe they spend a lot of time sitting. These kind of things would usually be more of a factor where we'd expect something happening in the lower back, the pelvis, or the hips. So if somebody does have sciatica, what we would usually advise is to go and see a more traditional chiropractor first, somebody who will be adjusting lower down in the body. We can always keep in contact, so if things are not improving, then maybe we do need to look and see what's happening up here, because maybe this is the missing piece, and there may be something here that affects things further down. As a change here doesn't just stop here, it starts to affect the posture and the rest of the body. But yeah, first step would always be see a more traditional kind of full spine chiropractor. And if it's not improving, then we can always do tests here to see if it's something that we can help with. For AJ or for anyone else, if you do have questions about this, you can always put them in the comments, or you can send us a message if you're not sure who you should go and see for low back issues and for sciatica issues. And if we're not the best fit, I'm happy to refer you to somebody else here in Singapore who would be the best fit for your case.